Welcome to this In Conversation with Children's Commissioners webinar, which is hosted by the Children's Policy Centre here at the Australian National University. I'm Sharon Bessell. I'm a Professor of Public Policy here at the Crawford School at the ANU, and I'm Director of the Children's Policy Centre. I'm in the south of Canberra, in my home today, on Ngunnawal land. This land has never been ceded, and I pay my respects to Elders past, present and emerging, and acknowledge all First Nations people who might be joining us for this webinar today. This webinar is one in a series that the Children's Policy Centre hosts. The Children's Policy Centre has three objectives. First, to undertake innovative interdisciplinary research on a range of issues relating to children's policy. Second, to seek to connect researchers, policymakers and practitioners working on a range of issues to promote the human rights, the wellbeing and the best interests of children. And third, we aim to communicate research findings to contribute to better outcomes for children and for young people. And these webinars with our amazing children's commissioners from across Australia are a central part of what we do. Today, I am absolutely delighted to introduce and to welcome back Anne Hollonds, Australia's National Children's Commissioner. Since her appointment in 2020, Anne has been a vocal advocate for children in Australia and has been very proactive in reaching out to and partnering with others in the field. And I won't spend a lot of time going through Anne's bio because I think by now she's well known to all of us, and I'd rather save that time to actually talk with you, Anne. It's great to have you with us today, Anne. Thank you.
Thanks so much, Sharon. And can I just say congratulations on the great work your Children's Policy Centre does. It's just wonderful to have this policy centre in Australia as a sort of a guiding light for the work that all of us are trying to do. So thank you very much for having me. I'm joining from the lands of the Camaragal people of the Eora Nations, and I pay my respects to their elders, past, present and emerging. And I'm delighted to be here.
And thank you. We're always delighted to talk to you. And without wanting to sound like a mutual admiration society right at the beginning, the work that you are doing is extraordinary. So thank you for that. There are a number of things that we wanted to talk to Anne about today. I sent Anne a list of many questions that we had to wind back considerably. One of the things that I did want to talk to you about at the start, Anne, was the work that you've been doing around the impacts of the pandemic on children and young people. Of course, we're moving out of pandemic lockdowns, but those impacts of children during the pandemic were deep, they were significant, and some of them will be long lasting. In June 2021, the National Mental Health Commission funded you and your colleagues to investigate those impacts of the pandemic on children's mental health and wellbeing. So I wanted to begin by asking you a little bit about the findings of that survey. Perhaps we could start by just asking you what kinds of questions you asked and how many children, young people and adults engaged with the survey.
Absolutely. And look, before I get into that, can I just say that just even thinking about this webinar today is an opportunity to reflect on what an extraordinary 2 years we've had. And of course, it's not over yet. And you know, as everyone knows, when you're busy, you sort of move on to the next thing and the next thing and the next thing. But this is a great opportunity to sort of reflect and remember how invisible children were during those lockdowns, how distressing that was. I remember I came into this role at the end of 2020, so the end of that first year of lockdowns. And it was just so obvious that children were not front and center in any of the media, the public statements by officials and so forth. And you know, I wrote to the Prime Minister several times asking for a national plan for children, a COVID recovery plan for children to try and elevate children's issues. And of course, as we all know, really children were not noticed until, well, really the 11th hour, just before school resumed this year. About a week before school resumed this year, suddenly there was this sort of plan for trying to reopen schools. but it was a very, very frustrating period. So we had this opportunity, as you said, to survey children and young people across Australia to find out what were their experiences in relation to their mental health and well-being. We got responses from over 4,500 children and young people aged 9 to 17, and 2,800 parents, guardians and grandparents to these two surveys that we ran. The sorts of questions we asked, Sharon, were really we wanted to understand both the positives and the negatives of this time, because different kids had different experiences, didn't they? So we asked about those, but then we asked specific questions about what they were worried about or concerned about during that past 2 years, what they'd missed out on, how confident were they to seek mental health help, and what were their preferred methods for getting help for their mental health, and what were the barriers, and what ideas did they have about improving supports for mental health and well-being, that sort of thing. So it was quite a wide range of questions about experiences, both positive and negative, and then drilling into specifically what mattered most to their mental health and well-being.
And as we continue this conversation, I'll just say to the large number of people who are in the audience today that we will have some time for questions and answers. So if you do have a question, please put it into the Q&A section of the Zoom, and we will get to those, as many of those questions as we can throughout this conversation. And I'm interested in hearing the real challenges that children faced and what we can learn from that. But I wonder if we could just start with some of the positives. What kind of positive things did children say about what was often a terrible experience for many of us?
Well, yes. I mean, and this won't be a surprise to you and your team, Sharon, because it really goes to some of the research that you've done about the importance of relationships in the lives of kids. And the positives really were about the fact that they had more time with their families, some of them. Of course, not everyone, and it wasn't positive for everyone, of course. But for those where it was positive, they liked the fact that they had more time. That their life was less rushed, and they had, perhaps both mum and dad at home with them. So they were the main positives, I guess. Of course, the negatives have also related to those connections. Kids talked about missing out on the social connection with their friends that they can get through school and other activities. And of course, some of them, also missed that connection with family because of the restrictions that we had. And they also talked about loneliness. Loneliness was quite a big issue that came through, sadness, even anger, and the feeling of missing out on those important things in their lives, and including missing out on physical activity. Some kids really pointed to that, and for some kids, they were fearful of catching COVID.
And I'm not surprised, as you said, that relationships figured so powerfully in the findings that you have. I've said this again and again, but I don't think I've ever done research with children over 25 years of working with children when relationships haven't been absolutely central, across the spectrum, from the wonderful, loving relations through to the really challenging, difficult relationships, central in children's lives.
And this comes out too in this survey and in others. When you ask them, who do you turn to for help, they will always say family and friends first, and rather than professionals or services or even online. Kids will always want to go to someone that they feel they can trust, whom they know, if they have someone like that in their lives.
And one of the really interesting things in the survey was some of the things that children said about the role of technology in their lives. What did you hear about the role that technology played during those COVID lockdowns and disruptions? And what can we learn from the role that technology did play in children's lives at that point in time?
Well, of course, we all know that everyone's technology use went up, and here we are still today, probably forever now, we'll be using technology to engage. But for kids, it wasn't always a positive. And some of the negatives they talked about was that they ended up doing gaming or being on YouTube for longer than they perhaps even wanted or would usually do. They actually got tired from being on their screens all of the time, and they found it very distracting and quite difficult to extract themselves from that. So, you know, of course, we know that technology can be very addictive, and overuse at very young ages is something that we're concerned about. Of course, from other research, we know that some kids totally missed out because they didn't have the tech at home, and that really exacerbated their social isolation and their inability to continue with their education.
And one of the things that we've been seeing in some research that we're just at the beginning of is the amount of screen time that some children are still spending their time on. You know, and we've talked with quite young children, sort of 9, 10, who are gaming or YouTubing, watching Netflix until 2, 3 o'clock in the morning, and then talking about the tiredness and the fatigue, but also, you know, often blurring the lines between what it is they're seeing online and what's actually happening in their lives. And of course, as I said, these are young children, 9, 10 years old. What kinds of conversations do you think we need to be having in Australia about how we think about children and the use of digital technologies? There are many positives about social media and about and the way in which children can access those technologies, but how do you think we need to have those conversations in a way that puts children right at the centre?
Yes, it's a really good question, Sharon, because of course, you know, our tech it's part of our lives now, being online, and we don't want to sort of prohibit kids from having the benefits that, as you point to the fact that there are benefits and there is, you know, access to information and experiences that we don't want to stop kids having. But of course, it is the number one thing that parents, when asked, say they're worried about. They feel a bit at a loss to know how to manage, particularly the overuse since the lockdowns. And the other thing is that the really serious side of it is the exposure to the dangers online, which is also there's been a bit of media attention on that the fact that during the lockdowns, kids were online for such long periods that they were more likely to be exploited. And so I think, firstly, there's a whole issue there about the regulatory frameworks for the businesses that operate these platforms. And I've certainly, amongst others, been part of submitting to and appearing before government inquiries, looking at the regulation of those businesses to ensure that the best interests of children are required, that they're required to demonstrate that they're placing children's best interests in their business model, so that there is that sort of positive duty on behalf of those businesses to not collect data that they don't need to collect, to ensure that consents are meaningful ones for children and young people to engage in, and so forth. It's a whole range of things that they need to be doing. But the other side of it, of course, is then that the parents, I think, need to be better educated about how to keep their kids safe online in the way that they do in the physical world, that it actually be part of everyday life, that kitchen table conversation that we all need to have with our kids and our grandkids. So, you know, I think there are many, many layers to this, Sharon. There is absolutely no easy answer to your question, but I think it's something that, I think we need to keep in balance the positives and the negatives for kids, rather than see it as a sort of a prohibition kind of response out of panic, which sometimes happens.
And we do know where prohibition generally leads us in terms of making things more attractive and making it more difficult to have the kinds of meaningful conversations that will really impact positively on children's lives. And one other thing that struck me out of the summary of your findings was that you found that around 13% of parents and carers said that they didn't have enough money to meet basic needs during that time. And many were experiencing stress about unemployment and financial instability. We're now seeing even greater pressures in terms of cost of living increases on families. Thinking about what we've learned, what came out of your survey, what you heard during that work from children and from their parents, from carers, from grandparents, what immediate steps would you like to see taken to ensure that the material essentials are met for all children and their families? Now, again, this is an incredibly difficult question, particularly in the context that we find ourselves. But what do you think we need to be starting to do as a matter of urgency?
Well, beyond raising job seeker, I mean, obviously, one of the big learnings through COVID was that when the coronavirus supplement was put on top of job seeker, that we lifted many, many thousands of children out of poverty. And so I think, post-pandemic, as we're climbing out of this pandemic, we shouldn't forget that, and we should keep the pressure on. I know that there are many online who would absolutely be advocating for this, for there to be for income security to be a much more important issue, particularly now with the change of government. But I just think we need to not take our foot off the accelerator on this. We need to keep the pressure on. I mean, there was a very interesting report you may have seen that Anne Summers did on domestic violence that came out a couple of weeks ago, where she analysed some new data out of from the ABS, which really reinforced poverty as an issue that keeps women in domestic violence. And then, of course, we know when they leave, they end up homeless. I've met a lot of young mums in that situation last year when I did my consultations. They had babies and toddlers and ended up couch surfing or on the streets, really in unsafe situations because they had left a violent relationship. And that's all about poverty. So I think that we've now got perhaps an opportunity to talk about this differently now, but we should not stop talking about it. The other related issue to income, of course, is housing, which is absolutely huge as a factor that creates risk and keeps kids and their parents in unsafe situations, and of course leads to the removal of children from their families just because they don't have a home. And we need to, I think, really be looking at some of these other countries in the world. I think Finland is one of them, where they have a program called Housing First. And that's the first thing they provide when someone's in trouble, is they find them somewhere to live, right? Like, it's a pretty simple equation that we know makes a huge difference in the lives of very disadvantaged kids and their families. So I think there's an enormous amount more work to be doing, and we need to keep up that pressure.
And I think that's right. I mean, we had some very good research, including by a colleague here at the ANU, Elise Klein, of the ways in which people had spent those COVID supplements. And it was on essential needs. It was on the essential needs of their children. I was having a conversation just last week with a group of people who are reliant on income support, and asked them what they'd spent those supplements on. And the answer consistently was things we desperately needed.
Yes.
And of course, those desperate needs are now no longer being met.
No, and things have just got harder, haven't they, as you said in your intro to the question. So this is something that is becoming more and more serious even as we speak. And we already know that you're more likely to be in poverty if you're a child than an adult. Those of us who are interested advocating for child rights and wellbeing. This needs to be at the forefront of our minds.
Absolutely. And just to stay for a little bit longer with the findings of your survey, but also starting to look forward to what we draw out of that. You found that 41% of children reported that the pandemic had a negative impact on their well-being. I mean, that is shocking, particularly given the silences that you pointed to. We've just written an article that will be published later this year, where we did some child-centred analysis of policy during the pandemic. And as you pointed out in your introduction, there was almost silence on children up until towards the very end. So perhaps we shouldn't be surprised that so many children were negatively impacted when we just weren't thinking about how to best support them. You also found that over half of all children reported negative impacts in terms of mental health and wellbeing. One of your first recommendations out of your report is a national child health or child mental health and wellbeing strategy. I wonder if you could just talk us through what a strategy of that kind might look like and how we can ensure that it's genuinely child-centred.
So Sharon, what that recommendation refers to is the fact that we already do have a national child mental health and wellbeing strategy developed by the National Mental Health Commission a couple of years ago. But it is just a strategy. It hasn't, to my knowledge, been funded yet, and there are no action plans coming out of that. But in that strategy, it really does look at what needs to be done with regard to the family and the community, the service, things like ensuring that families have an ability to respond better to the needs of children. So it's focused on children under 12, who we know are absolutely missing out at the moment in terms of the service system. By the way, in the consultations I did last year, I was really shocked at the number of families I met where they had taken, an 11 or a 12-year-old to the local public hospital for emergency treatment because of suicidality, and had been sent away and told to go and see a private psychiatrist because of lack of resources or not able to help them. And so people were being actually sent away. We do have a very serious problem in this country in relation to the workforce that is needed to respond. But so let me go back to the actual strategy. So it's the family and the community is one focus area, the service system, improving that, building the workforce that is trained to work with kids. At the moment, there are not many psychologists and psychiatrists who are trained to work with kids. And it focuses on education as a system and what can be done through schools as the sort of the front line in the lives of kids and their families. And we might talk a bit more about that in a minute. And also then about how we build the evidence and the ongoing evaluation of how those systems are working. So it is looking at a redesign process, but as I said, it is just a sort of a shell in a way at the moment. And it needs to be filled in with action plans. And I would argue at the moment, they've got the rights of children at the centre of the sort of diagram, but I think they need to evidence how the rights of children will be ensured through the implementation. If anyone wants to find it, you just Google National Child Mental Health and Wellbeing Strategy, and it comes up fairly quickly.
And could we pick up on the role of schools? And you noted then how important that is. We are seeing around the country the under-resourcing of schools, the pressure that teachers are under. And we also know from prior to the pandemic that in Australia, we have one of the least equitable education systems in OECD countries. But as you said, school is absolutely central to children's lives, and that's often the place that children will look when they need help, or it is the place where it's most evident that they need support. What are your thoughts on how we need to start thinking about the school system? It often does seem that every problem that society has is kind of pushed to schools, but without the resources for them to act. And I'd love to hear your thoughts on how we start to reframe the place of schools in our society.
No, that's right. I mean, you have to always start this conversation by saying we're not asking teachers to do more because we know their jobs are huge. But it was very clear during COVID that school is about much more than academic learning that you can replace with Zoom. And, you know, not only were children invisible, but families were cut out of the potential support that local school can provide. And so already we see that school is like a community hub. Obviously, some schools do it better than others, and that comes down to sort of individual leadership and the flexibilities that perhaps the local leadership has or doesn't have. But I think that it's clear that as a system, schooling is not fit for purpose to really meet the needs of the most disadvantaged in our community. So kids who are living with poverty or disadvantage, they need their support services to be local, to be integrated, joined up in that sense. This is what kids have told me directly and their families, that they need help for both adults and kids in the same place. You know, they're dealing with this incredible fragmentation of service systems. So I think just as we've started to do in many places, and I visited some of these services in the Northern Territory in particular last year, child and family, early child services, we're doing some great work where we're wrapping around a lot of health and education services together, but they stop at the age of 5. There isn't that transition to schooling. In fact, the kids don't transition to schooling because their families are alienated, or there are, you know, barriers of various kinds, and the school is not really fit for purpose for the kids and the families in that local community. It's very much an institutional model that says, we are the school, you have to fit into our institution. And it's predominantly, of course, as we know, a white middle class sort of model, without really looking at what are the needs of each community, which will vary across the country, right? So this is a huge redesign task, I think. It's redesigning those basic systems to be able to get better value out of them. I often say to ministers and MPs, that this is not about more money. This is about using the investments that we already make into something like the education system, which is huge, using it better, using it in a way that integrates with the health system, the social services systems generally, to ensure that we've got that layering of opportunities to get the help much, much earlier, and therefore to avoid that slide into an escalation of problems leading to involvement with the child protection system and then, of course, down the track potentially into youth crime, youth detention and so forth. I mean, it's just, if we could be doing a lot more earlier, I think that would ensure that we're using the money that's invested in a much better way.
Yeah, such fantastic points, Anne. And I just briefly refer to some research that we did with children a while back about what makes strong and supportive communities. And children talked about, the importance of being respected, of being safe, of being listened to, but also of resources being available. Yes. And interestingly, children said that if schools also had all those pieces in place, they would be good places to be. So it's making the connections between schools and families and communities. Exactly right.
That reminds me of just an anecdote. I met with kids in an after-school service in Palmerston, in Darwin, and they talked about how fabulous it was, a PCYC kind of program, how it was fabulous. And I said, what do you like about coming here? And they said that the people here, they understand us. They're often from a similar background. They don't judge us. In other words, they respect us. We trust them to talk about the things that matter to us. And in contrast, the high school was next door. And they were able to draw that distinction and say they did not feel that at the school. They felt judged by the teachers. They felt discriminated by the schooling environment. They didn't feel safe. They didn't feel they could trust the adults in that school environment, which is really heartbreaking to hear, right? These things really matter in the long run. And, you know, they're not, on the face of it, shouldn't be that hard to fix if we actually listen to what kids themselves are saying about what would make a difference to them. If we took it seriously, if we considered it not just as their insights or their views, but as their evidence. This is evidence from kids about how to redesign these systems. That's what we need to be doing.
And then I think on that, it so often, as we said at the very beginning, comes back to relationships. And that means having teachers that are well supported, that are well trained, and in sufficient numbers with low enough class sizes to be able to build those relationships that children need.
Exactly right. And the teachers, of course, need support, they need training, but they also need that wraparound of mental health professionals and other services that are integrated into their environment. So this is not about blaming schools or blaming teachers.
We have a couple of excellent comments and questions coming through on the Q&A, and one of them relates to exactly this. So I'm going to go to those, Anne, and read out the first from Kitty Turrell. Kitty says, schools as universal provision are definitely a crucial place to attend to children's wellbeing, but as you say, children are overworked. The recent Grattan Institute report is interesting, and one recommendation seems useful: to ensure non-teaching staff are well used in schools, so that every school has the kinds of resource sources that you're talking about, Anne, including social workers and mental health support. So Kitty asks, how might we advocate for schools to have access to social workers and so on, and value them as just as important as teachers? You may partly answer that, but I'll just...
Yeah, well, Kitty, you make a really good point. And, you know, from when I was in the front line I'm an ex-social worker, so what I recall is that schools were kind of impenetrable. So, you know, we would even try to run like parenting classes or different things, you know, in the school hall. So I might have been working in community health or somewhere outside of the school, tried to use the school facilities, and that you couldn't even if you wanted to, they wouldn't let you in. Now, I mean, I'm hoping that things have improved a bit on that front, but I think it is about, it needs to be a requirement, that collaboration between the school and whatever the local social services are, and every community has something. The question is, how well are they working together? What could be done to really strengthen that collaboration? Because presumably they're the same families, they're the same kids that all the school as well as all the support services are trying to help. So that happens in many communities really well, as I said before, because of the local leadership sees the need to do it, and there are more collaborative approaches. But I think in areas where that isn't the case, it's even more important that we get that not only an authorising environment from the top of those departments, but actually a requirement to do so. So I'd like to see, for example, school principals be rewarded for effective collaboration with the health services or the social services in the area. You know, like it needs to be part of their KPIs, that we need to signal somehow for all of these leaders in the various siloed services that are meant to be helping kids and families, that they need to do it together. They need to work together. They need to ensure that there are no gaps that kids fall through. And that really does come from the top. So it's not enough just to ask the local people to get on with it. They need that support and that authorising environment from the top.
And I think that takes us nicely into another question, which is thinking about sort of the transformative actions that we could take to genuinely create a child-centred society. And Chris Peters asks, Commissioner Holland, in lieu of a National Bill of Rights, do you see a potential opportunity emerging for something like the European Child Guarantee at either Commonwealth and/or state levels to better support childhood health and policy development? And I guess perhaps going from that specific question, it takes us into a wider range of issues of what are the initiatives open to us, available to us?
Well, that's a great question. Was that Chris who put that question? Yeah, thank you, Chris, for that question. So interestingly, I have written to the new government about the European guarantee, sent some links about that, because I actually think it's very interesting, because all of us have been used to the last sort of 10 years or so of kind of that really big division between state and federal, in terms of responsibilities. And yet you look at Europe, and the European Commission, it covers all the country, over 100 countries, I think. And they've all been able to agree that there will be these national plans that guarantee things to kids. Now, kids are, a really important issue in that's front and centre for the European Commission at the moment. So I honestly can't see why we couldn't do it in our country, why we couldn't actually bridge that divide between the Commonwealth and the states and the territories, and have that focus on children front and centre. So that's absolutely one way. I mean, we obviously still need to try to ensure that the Convention on the Rights of the Child is taken seriously in our legislation, in our policies, and the way that they govern the country, that we're actually using the convention in the serious manner that it should be. And of course, we've seen through COVID that really, if we had had the CRC incorporated, if we had have been using child rights impact assessments of some kind on the emergency measures that were taken, there might have been a chance that children's unique issues would have really seen the light of day, instead of being put on the back seat while the concerns of adults were dominant. And a lot of the decisions that affected children negatively were made in order to protect adults, not to protect children. And that's the truth.
Yeah, and I think that is one of the most powerful things we can learn from the pandemic and pandemic responses. And that takes us to some work that you have been doing around child rights impact assessments. Can you talk us through how those assessments work and how you would like to see them taken up in Australia?
Well, many of the people online might know that WA, ACT and Queensland already have state-based child rights impact assessment tools that have been developed, I think, by the local children's commissioners. What's not clear to me really is how much they're being used at a policy level, but I think that's a really important, we need to acknowledge the work that they have done. And so what I've tried to do is to look at how we could have one nationally in Australia that builds on the work that's been done by others here and also internationally. That is, if you like, a set of principles or questions that policymakers ask themselves about any new policy or legislation, but also retrospectively looking at existing policy as to, what are the impacts on children? What are the processes that are being used to assess those impacts? Is anyone talking to kids, for example? All of those things are, in terms of prompts, because we don't have a systematic way of doing this in this country. And I think one of the important things would be to actually alert the decision makers to the fact that this is an important step to take. Currently at the Commonwealth level, I will be invited to a meeting periodically, not in a systematic way, but where there's new legislation, they'll say, oh, we need to talk to the National Children's Commissioner and see what she thinks. But of course, it's like the day before the legislation goes before Parliament, sort of thing. I'm exaggerating slightly, but it's very much at the last minute. and it's a bit of an afterthought, and they have to tick this box, presumably, to say they talked to the Human Rights Commission about it, and in this case, the Children's Commissioner. But it's not, I don't think it's a very effective process, and I'd like to see much more thought given, obviously much earlier in the development of policy, but also retrospectively. And so what we've done is we've drafted a potential tool that could be used, that will need to be refined to make, ensure that it is usable by policymakers. This is not something that's meant to sit on a shelf. It actually needs to be useful. And even in countries like Scotland, Sharon, I don't know if you're aware, but even Bruce Adamson will say that their child rights impact assessment tool is not that useful for them. So, it is quite a tricky thing to do. But what we've also done is we've piloted this draft tool on the decisions made to close schools during the lockdowns. So that's the first attempt at sort of applying it to see what does it throw up if we ask these questions about those decisions during COVID. And it is my hope that we were able to circulate this, to get some interest in it, to refine it as we go and get it used across the country.
And we've got a few questions waiting, and I do want to get to those questions. Before we do, I did want to ask you, as you said, it's an imperfect process at the moment, but at least you're being invited to the table, which is an important step, an important
sometimes
baby step.
Sometimes. Not always.
I did want to hear your thoughts on the new government's approach and the opportunities that appear to be emerging. We do now have a Minister for Youth. We have a Minister for Early Childhood Education. How significant do you see those developments? And do you see an opportunity opening at the moment with the new government's approach? And what are the ongoing challenges?
Well, I've certainly noticed already that it's kind of easier to talk to about these things. It's an easier sort of opening conversation to have about children. Excuse me. Having said that, I'm not quite sure that apart from the election promises that have been made, for example, the early years, there's going to be an early years strategy developed. There's going to be something to do with youth engagement, not quite sure what. Those sorts of things. Apart from that, I'm not sure that there is, what I would say is I think there's a lot more work that needs to be done to really understand the depth and the complexity of system redesign work that needs to be done, based on what we were just discussing earlier. So I am very much encouraging that whilst they are pursuing their commitments for their election promises, which is what they obviously want to and need to do, that there is perhaps a conversation that can begin and work that can begin on a longer term roadmap for reform, which will go way beyond one term of Parliament. It will go, 2-3 terms of Parliament and needs to be sustained. That does look at redesigning, reforming those basic systems that are meant to be helping kids and their families, especially the ones who are living with poverty and disadvantage. This is our chance now to begin that conversation. The best signal that I've really heard is from the Treasurer, who is talking about a wellbeing budget. The Treasurer is the member for Logan, so he, I know, understands a lot of what we're talking about today. And it is my hope that he won't get distracted by all the other problems that, of course, they find themselves dealing with, but that we'll be able to pursue what he described. I heard him say this morning that they want to be measuring what matters most to people. And so while he's been talking about a wellbeing budget, I want to make sure the child gets put in that mix. Not there yet, but that's certainly something that all of us can be asking of our elected representatives, to ensure that it is right there front and centre in Treasury, where, you know, so that then we can see it flow out to the rest of the policy departments. So in summary, Sharon, I think, you know, the signals are good, but it's very early days for many of these new ministers, and they've got a lot of work to do, just even on the promises that they've made. And beyond those promises, I think there's a lot more work to be done.
There are extraordinary challenges facing the new government, and I think we do need to recognise the extent of those challenges. But as you say, the openness to conversations and the change of language, I think, is really quite significant. I guess, Anne, I'd just add that, you know, we have the Minister for Youth, and we'll see how that's defined, and the Minister for Early Childhood. I guess my concern, and the issue that I'll be watching closely, is that we don't miss middle childhood in all of this. We often have policies focusing on young people as they transition into adulthood, a focus on early childhood for all good reasons, and it's often middle childhood, which is also critically important, that's missed.
Well, yes, I don't know why you just have youth and early childhood. Like, why not have a Minister for Children and Young People for a start? I have made that point, by the way. But the other thing is that I think we also need a task force of all the ministers who have relevant responsibilities, like the Minister for Health, the Minister for Education, the Minister for Social Services, the Minister for Indigenous Australians, you know, etc. We need them working together, because we know that kids don't live in one silo, and their issues cross those boundaries, and that the kids are the ones who fall in the gaps between the systems that are not well connected. So even having a Minister for Children is not enough. We've got to also have that cross-portfolio mechanism right at the top, to support the better integration of service systems on the ground.
I'm now going to go to some of the questions that we've got in Q&A. There are some great questions there, and we're going, as always, Anne, when we talk, to run out of time, but let's see if we can respond to some of these questions, or at least give them an airing. From Amy Lemoyne, I hope I'm pronouncing your name right, Amy. I often get it wrong. Amy says, do we have the right policy frame to address child poverty? And she notes that Australia doesn't have a national strategy to end child poverty or national measures for child poverty. Amy, I'm going to answer your question immediately by saying, no, we don't, but I'll throw to Anne to see if you have more to add, Anne.
Well, no, we don't. But if, as I said, the Treasurer is serious about a wellbeing budget, and I know they are looking at New Zealand's as a bit of a model, then child poverty is part of the New Zealand wellbeing budget framework, and it is very much my hope that they'll move in that direction. But of course, what they're going to need in order to address it is this roadmap for reform I've been talking about. They need to recognise the complexity of the task. They need to recognise that it isn't a matter of, a new program here or a new program over there. This is fundamental systems redesign of those basic systems, the health, the education, social services. They need to be designed to lift kids out of poverty, to empower families to raise their children to be safe and well. That's what we need to keep our eye on. And I think this is because it is so complex and it is long term and it goes beyond one term of Parliament. I think that's been one of, that's been why it's been hard for governments to get to this. It's hard. It's really, really hard. And I think they need help from all of us to achieve this.
I think that's right. And I think the opportunities to look at the ideas of a wellbeing budget, of wellbeing strategies are really significant here. And of course, we can never achieve wellbeing if we don't first address poverty. If we don't look at reducing poverty as the scaffold on which we build wellbeing. And we have a question from Talia Abrahamson. Talia asks, regarding the diverse experiences of childhood, did you explore intersectionality? And building on this, did your consultations and surveys identify strengths from particular groups that might be built on as actions for all children?
So, Talia, if you're referring to the mental health survey, it wasn't able to go to the nuances of what you're raising there. Not quite sure, Sharon, have you got a clue as to where we could go with that question?
I think this question of intersectionality is a really interesting one, and it is actually hard to capture in surveys often. You need very specific information around identity to be able to do that intersectional analysis, to understand how, I think, class, gender identity, geographic location, ability, disability, ethnicity, indigeneity, all come together and intersect to shape children's lives. It's an emerging issue or an emerging focus, how we ensure that we have intersectional analysis to base policy on, but it does require a very clear focus on ensuring that we get all of that kind of information to see how it's playing out.
Yes, so you'd have to complement any kind of an online survey with some qualitative work, I would presume, to really drive into the nuances there and to derive from that what policy should be incorporating to ensure that the well-being of all kids is looked after, not just the few, right?
And to see which groups we might be missing.
Yeah.
I think that's and also a very important part of that lens. I wonder, Anne, in terms of the second part of Talia's question, was around strengths from particular groups that could be built upon, and perhaps here it would be an opportunity to go back to some of the positives that you heard through the survey, but also through your broader consultations, and how we can build on what children said were the positives in their lives. As we think about things like child rights assessment, impact assessments, about a wellbeing approach, how do we draw what we know matters to children? Well,
this is where I think it's really important that children's rights and wellbeing are talked about in the context of their relationships, not as, kids are not isolated units. That's what we see again and again in all the research, that the most important relationships in their lives are the ones that we, from a policy perspective, should be protecting, should be supporting, should be empowering, because that's, from when they're tiny all the way through, actually. It's the quality of those relationships that matter most to kids. I mean, that's what, just quite from a separate field altogether, there was some interesting research from family law about what home means to children, and the definition of what home, the concept of home was. Of course, as you know, when people separate and divorce, there's a lot of fights between the adults about how much time the child will spend in each home, each house. When you ask kids, they go straight to the quality of the relationships. That's what matters most to them. It's not about the amount of time. It's not the things that the adults in their lives are fighting over. They just want to have those very, those important relationships. They want to ensure that they're able to continue them, and that they're able to spend positive time with the people that are most important to them in their lives. So that's what home means. So I think as all of us as a group of advocates or researchers or policymakers, that we should be ensuring that we don't rob children of their home, that we're doing everything we can to strengthen those relationships. And I think that would apply to kids of all kinds, actually, but particularly those kids. And I am reminded of the fact that the negative mental health impacts were particularly felt in this survey that came out through the non-binary kids who tick non-binary or diverse gender kids, and girls in particular were the ones who said that their mental health had been affected substantially by the pandemic.
And then I guess that's where we're starting to see the beginning of some of that intersectional analysis, where we know children were impacted, children weren't thought about in policy, but then we start to see for non-binary children or for girls particular issues emerging, where we may need to be paying special attention and ensuring our responses really reach those groups.
That's right.
We are very close to time. There's a comment in the Q&A from Sue Packer, which I'll read, and you might like to comment on, Anne. Sue says, more basic than health professionals, etc., to be welcomed and supported in schools. Parents and families in so many schools feel alienated, unwelcome at school, even discouraged from being there. Certainly not welcome to schools, and there seems to be nothing being done at looking at ways to incorporate families in schools. This needs to be a further recognition on the importance of relationships and children learning best when they feel secure and relevant. We've spoken about schools being social hubs for decades, but we're not making progress, and COVID is being used as an excuse not to progress it. More a comment than a question, but Anne, you might like to comment on it.
I would absolutely agree. And again, my consultations last year in the most disadvantaged communities that I visited, I only visited disadvantaged communities, but it just struck me that that's where the families were saying they did not feel they belonged or were welcome in the school. And I just could not understand it. And these were places that had problems of crime, youth crime on the streets, because the kids also then didn't feel they belonged. So it's like, why wouldn't you embrace and invite the whole family in and to make sure that that the engagement is a really meaningful one, because we know it actually works. So that's incredibly frustrating. But look, as a grandmother that I am now, I know that they're not even in the cities, wherever, they're not inviting families much into schools because of COVID. It's just become really quite difficult, I think. And I'm hoping that they will be able to get over that and to really sort of open up the school environment much, much more to the local community and to families in the community in a better way. But I agree with Sue that we've been talking about this for a long time. We actually need a plan to redesign how schools work. And it needs to be, as I said earlier, that we need to reward the leaders of the schools to behave in certain ways that achieve what we're talking about. Needs to be part of their key performance indicators, as well as that of the health professionals and the social work professionals and so forth in the community. That we need to see collaboration across those systems as something that we know from what kids and their families tell us is what we need to do.
And I think Sue's comment is as always such a powerful one, and the point that you make is so important, that we're not going to address some of these issues by tinkering around the edges in a piecemeal way. No. We need a holistic plan around how we can rethink schools in a way that's child-centred, that gives school leaders and principals incentives, and also ensures the teachers are well supported within that process and brings families in. So there's quite an agenda. But there's a lot of thinking that gives us the foundation for doing exactly that. Mm-hmm. And we're almost at the end. I have one final question for you. There is a question in the chat, though, asking if the survey and findings are publicly available. And I should have made it clear at the beginning that this is a little bit of a sneak peek. We've brought you some early findings to tantalise you. But and when the full report is available, people can find it on your website.
Yes, it'll be on our website when it comes out, and I hope that it won't be too much longer now.
So keep an eye on that. We'll also put it out, if you would like, Anne, through the Children's Policy Centre on our mailing list, so people know when it's out. And Anne, as we wind up what has been an incredible conversation, a wide-ranging conversation with so much food for thought and ideas for how we move forward, I just wanted to ask you again another big question, but given all of the consultations that you've done with children and their families and the findings of the ways in which the pandemic has impacted children, what's the message that you would give to government, the perhaps single most important piece of advice for the new federal government as they listen to all of these ideas about what needs to be done?
Yeah. I was asked this question in a slightly different way recently, Sharon. I was asked if I got a meeting with the Prime Minister tomorrow. What's the one? And I could tell him one thing. What would be the one thing? So which is kind of the same question. And I really, at this stage, what I would like to say is that, you know, great, good on you, congratulations, you know, and you know, the things that you've promised to do. But we have a lot of other work to do here. We need to build that reform roadmap. All the things we've talked about today, Sharon, actually are part of it. Those basic systems that are meant to support people. We need to be listening to kids and their families about how they need to be redesigned. And we need to start now. That's the one thing I would ask, knowing that we won't have this roadmap in place in any short period, and in fact it needs to be sustainable over many terms of Parliament. But it's an absolutely crucial conversation. None of this will ever change unless we proactively work out a plan to change it, to build the accountability for that change, and for implementing the evidence that is already available about what needs to change. Then we have decades of evidence that we can draw on. We don't actually need more reports about these things. We just need to now implement the evidence and hold them accountable for it. That's the roadmap I want to see. That's my one ask of the Prime Minister.
And thank you so much for joining us today. Thank you for the role that you're playing, for the advice that you're giving to the Prime Minister. I think that advice would genuinely make Australia a better place for children to live in, to grow up in, and to be happy in. So let's all work towards making that real. It does feel at the moment as though we perhaps have an opportunity to begin that journey in a way that we haven't in recent years, and that is very exciting.